Hello friends, let us now learn some important points about the DNA gyrase inhibitors. So, DNA gyrase inhibitors include quinolones. So, these quinolones are nalidixic acid. Nalidixic acid is the only true quinolone. This nalidixic acid will inhibit DNA gyrase. Nalidixic acid inhibits DNA gyrase. So, pharmacokinetics of nalidixic acid is oral absorption, partly metabolized by the liver, and it is excreted in urine. So, the side effect of nalidixic acid is it causes headache, drowsiness, vertigo. It causes visual disturbances. It causes seizures and phototoxicity. The main use of nalidixic acid is it is used as urinary antiseptic. Then we have fluoroquinolones. Now the mechanism of action of fluoroquinolones. The drug fluoroquinolones will inhibit bacterial DNA gyrase. It will inhibit bacterial DNA gyrase in gram negative organisms. Normally, DNA gyrase has two subunits, 2A subunit and 2B subunit. 2A subunit nicks the double-stranded DNA, whereas 2B subunits introduces the negative supercoils. Then 2A subunits will seal the nicked ends. That is the main action of DNA gyrase. So, if you see, we have 2A subunit. This 2A subunit, if this is the double-stranded DNA unit, it will nick the ends. Right? This is the nicked ends of 2A subunit. Now then 2B subunit will come and introduces supercoils in it. So it has introduced supercoils in it. And again now the 2A subunit will come and it will seal the ends completely. So this is how it acts. First 2A subunit will act and it will nick the double-stranded DNA, and 2B subunit will come and it will introduce the supercoils, and again 2A subunit will come which will seal the nicked ends. Now if we inhibit this DNA gyrase enzyme in gram negatives, it will prevent this will prevent relaxation of supercoiling, and thus it will arrest the DNA replication. And then in gram positive individuals, fluoroquinolones will inhibit DNA topoisomerase 4. Fluoroquinolones will inhibit topoisomerase 4, and these topoisomerase 4 in gram positive organisms, so these fluoroquinolones inhibit the enzyme bacterial DNA gyrase, which is present in gram negative organisms, and this will prevent the relaxation of supercoiling, and thus it will arrest the DNA replication. This is what happens in gram negative. In gram positive organisms, these fluoroquinolones will inhibit the enzyme topoisomerase 4. This topoisomerase 4 will normally nicks and separates daughter DNA strands after DNA replication. These topoisomerase 4 will nick and separates daughter DNA strands after DNA replication. Now, this topoisomerase 4 also interferes with the separation. So, in mammals, if you see, the fluoroquinolones will inhibit the topoisomerase 2. Fluoroquinolones will inhibit topoisomerase 2, and thus it will inhibit the supercoiling relaxation. So, the most effective for gram negative aerobes, it is most effective for gram negative aerobes and followed by gram positive. Not much effective for gram positive organisms. So these fluoroquinolones can be are of two generations. We have first generation fluoroquinolones and second generation fluoroquinolones. First generation fluoroquinolones include norfloxacin, ofloxacin, ciprofloxacin, pefloxacin. So second generation fluoroquinolones include levofloxacin, lomifloxacin, sparfloxacin, moxifloxacin, gemifloxacin, and prulifloxacin. Now first drug, ciprofloxacin. This ciprofloxacin has shortest half-life. So the drug ciprofloxacin has shortest half-life, that is 3 to 4 hours. So this ciprofloxacin is also most active fluoroquinolones against the Pseudomonas. Then we have the drug sparfloxacin. Sparfloxacin has the longest half-life. Ofloxacin, moxifloxacin, and levofloxacin, these three are also the respiratory fluoroquinolones. Then the side effects of these respiratory fluoroquinolones is mainly causing QT prolongation. Then we have multi-drug resistant TB. MDR TB is caused by levofloxacin, whereas XDR TB is caused by the drug moxifloxacin. Now if you see the uses are first, now uses of fluoroquinolones, these are very important. Ciprofloxacin is the drug of choice for prophylaxis of anthrax. This ciprofloxacin is orally preferred agent for typhoid prostatitis. It is orally preferred agent for typhoid prostatitis. Ciprofloxacin is most active fluoroquinolones for Pseudomonas infection. It is most active fluoroquinolones for Pseudomonas infection. Then ofloxacin, then we have moxifloxacin and levofloxacin. Ofloxacin, moxifloxacin and levofloxacin are respiratory fluoroquinolones. Bacterial diarrhea. So this ciprofloxacin is the most active fluoroquinolone for Pseudomonas infection, including cystic fibrosis. Then in bacterial disorders, diarrhea caused by Salmonella, Shigella, enterotoxigenic E. coli, we can use fluoroquinolones. Osteomyelitis, also we can use fluoroquinolones. Phenofloxacin is used in otitis externa caused by Pseudomonas and Staphylococcus. Now, ciprofloxacin is also used in the prophylaxis of meningococci. Then if you see the side effects, the most common side effect of these fluoroquinolones is GI side effects, where it causes nausea, vomiting and diarrhea. Then it also causes photosensitivity. The photosensitivity is maximum associated with sparfloxacin, lomifloxacin, and it is associated with pefloxacin. Then this also causes QT prolongation, like it causes QT prolongation is caused by ofloxacin, moxifloxacin and levofloxacin. This QT prolongation is also caused by sparfloxacin and gatifloxacin. Then hepatotoxicity. Hepatotoxicity is mainly we have travofloxacin followed by pefloxacin. Hepatotoxicity is caused by travofloxacin followed by pefloxacin. Pefloxacin is safer in renal failure, whereas travofloxacin is mainly withdrawn. Then we have side effect of hypo or hyperglycemia. So this side effect of hypo or hyperglycemia is caused by gatifloxacin. Because of this side effect, this drug is withdrawn from the market. Then we have the drug photosensitivity. Photosensitivity is caused by sclenofloxacin and thus it is also withdrawn. Then hypoglycemia. Is caused by moxifloxacin. Then we have gripafloxacin. Gripafloxacin causes arrhythmias mainly due to the prolongation of QT interval. Due to the prolongation of QT interval, it causes arrhythmias. Then this gripafloxacin is also withdrawn. Then we have ciprofloxacin. This ciprofloxacin or pefloxacin will increase the plasma concentration of methyl xanthines like theophylline, and thus it increases the toxicity of this theophylline. So ciprofloxacin, pefloxacin will increase the toxicity of theophylline. Temofloxacin causes immune hemolytic anemia. So because of that, this temofloxacin is withdrawn. Then FDA issued warning regarding peripheral neuropathy, which is caused by fluoroquinolones. FDA issued warning regarding peripheral neuropathy caused by fluoroquinolones. It also causes tendinitis, tendon rupture, and also arthropathy. And thus this drug fluoroquinolones, because it causes tendinitis, it is contraindicated in children and also in pregnancy. It is contraindicated in children and pregnancy. Pharmacokinetics are moxifloxacin, travofloxacin, and pefloxacin. All these drugs are excreted in hepatic route. And these moxifloxacin, travofloxacin, and pefloxacin are safer in renal failure. Then we have the drugs like, then after that we have the drugs like sparfloxacin, moxifloxacin, and travofloxacin. Sparfloxacin, moxifloxacin, travofloxacin have longer half-life, and these drugs are administered once daily. Then we have newer classification. In the newer classification, first we have 4 types. First we have first generation or narrow spectrum gram negative fluoroquinolones, which are norfloxacin and lemifloxacin. Second generation fluoroquinolones include ciprofloxacin and ofloxacin, whereas third generation fluoroquinolones include levofloxacin, gatifloxacin, pefloxacin, and sparfloxacin. These third generation fluoroquinolones mainly used in gram positive. Then we have fourth generation fluoroquinolones, which include moxifloxacin, fluorofloxacin, garinafloxacin, gemifloxacin, and travofloxacin. These have broad spectrum action. Then we have to learn about the interactions of fluoroquinolones. So in the interactions of fluoroquinolones, these drugs can be combined with NSAIDs and increases the CNS toxicity and seizures. These drugs can also be combined with antacids, sucralfate, and iron salts, and thus decrease the absorption of fluoroquinolones. These drugs also combined with theophylline, caffeine, and warfarin, and also increase the concentration of fluoroquinolones. So this is about the fluoroquinolones. Thank you for watching.